The government has set aside 2.4 billion shillings to help eradicate neglected tropical diseases in the country. Health Principal Secretary Susan Mochache says statistics show that 25 million Kenyans are at risk of tropical diseases. Mochache, however, noted that government is fully committed to exploring innovative ways to accelerate progress towards ending the neglected tropical disease by the year 2030. Here's that report.
Speaking at the Global Summit on Neglected Tropical Diseases, Health Principal Secretary Susan Mochache noted that the neglected diseases remain a major focus in the planned rollout of the universal health coverage.
Our determination to guarantee the best health for all Kenyans is further buttressed by the fact that our universal health coverage, the insurance cover, it does provide for the case management of a neglected tropical disease.
Mochache observed that the government is scaling up the mapping of the neglected tropical diseases to allocate sufficient resources to further step up and apply treatment where the cases have been identified.
We are in that process of identifying our burden so that we can make sure that we put the appropriate resources. We as a country, we have allocated 2.4 billion shillings for neglected tropical diseases.
Health experts citing poverty as a major factor that has led to many Kenyans failing to access to quality and affordable health care.
Many times people who are infected or affected by NTDs are also affected by poverty because of the pressure applied to these communities by NTDs.
And indeed, non-communicable diseases are endemic across Kenya and primarily affect rural communities where there is low access to sanitation and to clean water. That NCDs afflict, unfortunately, the poor amongst our communities.
The Global Summit that is set to end on 1st June aims at exploring best practices to accelerate progress towards ending national tropical diseases by the year 2030. The government says neglected tropical diseases remain a global threat. Locally, measures are being put in place to permanently secure the population against the diseases, a program the government hopes to achieve by 2030. Jacqueline Masharia for Prime Edition.